gynecomastia in teenage or adolescent period, when should you actually consider whether you should undergo surgical correction or not? You must understand that gynecomastia is a condition, it's not a disease, which clearly outlines that if you're a male teen with an enlarged chest, it does not necessarily mean that you have to just worry and look at solutions immediately, all of that. What you need to know is, as a young adult, if you want a sculpted chest, you need to follow certain disciplined lifestyle since you are about to hit the puberty period. That is, to make sure that you have a good testosterone level in the body, you have to involve yourself in nice, aggressive physical exercise. You have to consider weightlifting, which will increase testosterone in the body. For example, if you look at both men and women involved in very active sports, you will see ladies involved in very active sports having broad shoulders, little smaller chest, and the physics more like physique which is more resembles a male chest. Similarly, if you look at men who are not at all involved in any exercise, they are very being like a couch potato, just a very bad lifestyle. Male children tend to have with a nice fat deposit around their waist, enlarged chest, all of that, because there is not enough testosterone being produced in the muscle that could be when you do aggressive physical exercise. So in the adolescent period, gynecomastia usually develops because the dominance of estrogen or estrogen-like substances are higher in the body compared to testosterone. So it actually stimulates a breast gland proliferation hypertrophy. Along with that, some fat accumulation happens. Normally, if it's very minimal, which is a normal feature during puberty, it involutes, we call it back, it shrinks when that hormonal stimulus is withdrawn. That is, it can start at puberty, and within few years from puberty, let's say you hit puberty at around 11, 12 years, and 14, 15 years, you have completed the pubertal period, then what happens? It involutes itself. But for that involution to be complete, you should have had just a very minimal stimulus in the beginning. But suppose you were obese child, and there is a process called aromatization where testosterone can convert into estrogen in the peripheral fat. Then what happened? Addition to your sedentary lifestyle, this peripheral estrogen push actually will cause enlarged chest, and you develop gynecomastia. So for a teenage boy with gynecomastia, irrespective of the age, if you have a small gland, you can wait until the pubertal period is completed, 17, 18 years, to see if the gland involutes. However, if you are just about 14 years, 13 years, and you have a really enlarged gland, it's not going to completely involute at all. But on the flip side of it, having a heavy enlarged gland for a longer time, it's like filling a balloon with water and holding it. The weight will keep expanding your skin. You lose elasticity of the skin. So the flip side of waiting too long is that the skin will not redrape. You may have skin laxity even if the surgery is done after you're 22, 23, because you had a grade 2 or a grade 3 gynecomastia ever since you're about 13, 14 years of age, and you carried it on till 24, 25. So the longer you had that weight on the chest, it has caused the skin to expand. And because there is significant expansion of the skin, it loses its elasticities and the collagen. And so you see some stretch marks being developed. You see that nipple and the areola actually, because the skin is stretched, it descends from its normal position called ptosis. So when you come for a gynecomastia surgery at a little later after completing your teenage, now the surgeon will have to look at possible ways how your nipple areola complex can go back to the normal position, skin can retract. So if you wait longer, you may actually need additional procedure or additional energy devices to cause skin retraction and skin tightening. So to answer this particular question as about gynecomastia in teenage, when you should consider surgery, first to advise to all the boys, please involve in outdoor aggressive sports. Ever since you're hitting your pubertal period, do aggressive physical sports. And if you notice enlarged chest during your teenage, if it's small, wait till you're 18 years of age to allow it to involute on its own. But if you have a bigger chest, see a plastic surgeon to understand at what stage you are, and either you can try to wait till 18 by involving in aggressive physical exercise, provided it is small enough and the surgeon tells you that it has a chance to involute. Otherwise, you should consider the surgery early, because the procedure will become more simple if you have a smaller gland rather than allowing it to become very big and the skin becoming stretched. This is Dr. Jayanti Ravindran giving you all details about teenage boys having gynecomastia and when you should consider operation from Tamira.